My name's Candice. It's my husband Tom, and I've had migraines for about 11 years. And they started when I was 20. I'm not sure if it was due to the area I was working in at the time because there was a lot of construction, allergies, or if for some reason they just came on suddenly. But I would go to work and it would get so bad on the way to work that I would have to literally stop. Sometimes have to have either someone come and get me or completely go home. They were just miserable. They went away for a little while, and I don't know what caused it to go away. There was no change in diet or anything else. And so when I guess it was almost 7 years ago, I met Tom. And so my headaches were bad off and on. They weren't constantly bad. And then for the past 5 years, they've been pretty miserable. And 5 times in the last year, if not more, I was in the ER for an hour. Can you imagine an hour visit? And I mean, it just takes its toll on both of us to have that much pain, me not being able to do what I need to do at the house, and then relying on Tom for everything. And so I'm sure it's just, and for my whole entire family too, because they would help out with my son, because I have a 22-month-old. And so they would help out and have to come over and help us out. So it's just been really hard, and having this implant has been great. It's just been tremendous. I first started going to see a neurologist 4 years ago when we moved into our new house. And she put me on different kind of blocks and all kinds of seizure medications because she would figure that maybe something that would stop a seizure would end up stopping the migraines. And I've tried, she would put me on narcotic medication for pain, and it would break through that narcotic medication. And then she'd have to try a different one and go to different medications. And then I switched because she got to the point where she couldn't help any further. And so I switched to a different neurologist, and she tried me on the same medications because she wanted to see how her levels would work. She even tried the blocks that they put in your forehead, or not in your forehead, but in the back of your head, because you have nerves right there. And so she thought that it was nerve pain being sent to my brain from like damaged nerves from my neck. But it ended up not being that either, so they're not really sure what caused my pain. And so the different neurologists that I've seen, and I tried 2 other in between seeing neurologists, and just nobody seemed to could help it. And all the pain medication that they gave that was actually for headaches, it never caused them to go away. I found out about reed migraine actually through my mom, because she got to the point where she thought it was just absolutely just too much for me and Tom to bear for me to have to keep going to the ER. Because I think in 1 week I went 3 times to the ER. And so she was online and tried to find best migraine doctors in Dallas, Texas, and she came across reed migraine.
Well, when she had migraines, as you heard, she had to go to the hospital several times, so I'd have to take off work. Thankfully, work has let me. But what I really didn't like, I guess, is that we couldn't go outside, we couldn't hang out with our son, we couldn't go to the park, which is across the street. She would be like, I can't go with you. I'm like, well, it's right there, let's go. But she just couldn't. If she got a headache, she was either in the bathroom or in bed just trying to sleep it off. And sometimes that didn't work, sometimes it did.
When I first woke up from the trial, my head hurt a little bit, but I think it was from all of the actual work that was done. But going home the day of the trial, I felt better. It was like 90% better than I felt in so long. And it was a great feeling. And all I wanted to do was just do things that I haven't been able to do. Go outside and sit in the sun, or go play with dogs, or play with my kid on the grass, or, through all kinds of allergy stuff that could cause headaches, or just anything that would actually just to see if I could cause a headache. And I mean, thankfully, none of them, if I got one, it was able to be controlled. And that was the best thing. When I got the permanent implant, it was so much better than the trial, because with the trial, I felt a few headaches and I felt I could control them. But when I actually got the permanent implant, I can tell that if right before I get one, I can do a different kind of setting with my programs, and it can cause it to break up before it happens. So I don't get that pain, because with this trial stimulator, they can't do as much programming to cause it to be like different adjustments. You have a few settings that you can use to try to break one up to cause it to go higher or lower. But definitely with the permanent implant, I can tell a humongous difference more than with the temporary. It's been great because all I do is I turn it up if I get a little bit of a headache, and it goes away. And then if it gets really bad, I just turn it up to a higher setting and knock it out. And for me to be able to play with my son, that's worth 2 months of going through trial and surgeries and implants. It's completely worth it to get to play with my son. I haven't had any limitations. My only thing is I'm still getting used to the bending over, and I mean, sometimes I get a little bit of a jolt, you know, if I have it up too high and I bend over too fast, but I mean, it's a process, you know, it's something that's implanted that you have to get used to, and you have boundaries. Obviously, I could probably go skydive, but I'm a little bit afraid of heights, so I probably wouldn't do that, but you know, I like riding horses, and it'll obviously take a while because where you have incisions and stuff. And so, but I mean, with going to the park with my husband and then going to the park with my son, and I've had no limitations with that.
I've never heard of something like this, and I read that this was something similar for backs, but not for a head, and I was just skeptical, I guess. Especially since everything she's gone through thus far, seeing millions of doctors, how can this one doctor really have the way? So yeah, I was skeptical. I'm glad she went through it though.
And I would tell someone that's at their wit's end, that's had it with their life, that they lead, that they're inside all the time, that they're missing out on half their life, if not more. Do it. You have to. You have to do it for yourself. You have to do it for your family. You have to do it